Okay, we're gonna start with this learning session. First of all, good morning, good afternoon, good evening to all of you. Warm welcome to everyone joining from all over the world, especially those connecting late at night. My name is Mark. I'm working with UN Habitat on the Urban Health stream. Thank you for joining to this learning session that is going to be about young people, youth housing and health. This event is part of please Teresa, if you can share the slides. Okay, I think, okay, yeah. Thank you. This event is part of the Urban Health Learning Sessions, which we organize every year. In previous editions, we've been speaking about biodiversity, extreme heat, AI, and this year we are exploring a topic that is becoming or has become one of the core priorities of UN Habitat in our new strategic plan, which is housing. Today, 2.8 billion people live in inadequate conditions, including over 1.1 billion in informal settlements. By 2030, nearly 3 billion people, around 40% of the world's population, will not have access to adequate housing. Poor housing conditions, overcrowding, and lack of basic services continue to drive preventable and premature deaths. These risks are further intensified by rapid urbanization, climate change, poverty, displacement, and persistent inequalities. The global housing crisis is a public health crisis. We are facing challenges across countries and regions, each with different manifestations but with similar impacts on health. In this session, we will examine the different interlinkages between housing and health, from the role of habitability in shaping the well-being and health of residents to the importance of social dimensions such as tenure security, and finally to the climate resilience of housing systems. We have an exceptional lineup of speakers who will explore these conditions with a particular focus on youth. They are highly knowledgeable and bring strong hands-on experience from the field. We look forward to the insights they will share and to learn together around these crucial niches. So for today's agenda, we're going to divide the session in four different segments. We'll have an opening keynote presentations, which will position housing and health and youth in the global agenda context. We'll have the main panel segment with our three speakers who will explore different interlinkages and interconnections from housing, from habitability lens, from tenure security and other social dimensions, and also with a climate resilience perspective. Following this main segment, we will have a closing keynote presentation that will wrap up some of the reflections and discussions that have been discussed by the previous speakers. And it will be followed by 15 minutes panel discussions where the audience will have the opportunity to pose questions to our speakers. We encourage participants to actively engage in the discussion, whether with questions directly targeted to specific speakers or to the whole panel. We will prioritize questions from the audience, so please feel free to submit any question you have while the speakers are presenting. We will be taking them into consideration and we will bring them during the panel discussion. You'll be also able to raise your hands and also speak up during the panel discussion. Just a few housekeeping rules. And just before we begin, this session is going to be recorded. It would be uploaded to our Urban Health UN Habitat YouTube channel. Please keep your microphone muted to avoid any noise disturbances during the speaker's interventions. And as I was mentioning, write down your questions and keep them for the Q&A panel, share it on the chat, and please indicate if the question is for a specific speaker or to the whole panel. With no further ado, it is my great pleasure to invite our first keynote speaker, Natalie Robel, who leads the WHO work on urban health. She developed WHO's new global guide on strategic approaches to urban health and has long worked on housing, air pollution, and slum upgrading. Natalie will situate housing and health within the global agenda and will reflect on how physical, social, environmental dimensions shape youth, health, resilience, and equity in alignment with SDGs. Natalie, the floor is yours. Thank you.
Thank you very much, Mark, and thanks to all participants for joining us in this important discussion today. So maybe if I could have the first slide, please. I would like to start with a couple of sentences to set the scene. Do we have the first slide? While the slide is going to be uploaded, I will keep going, and then maybe the first slide can then come up. I'm representing WHO, as Mark has introduced me, and there is absolutely no question that housing is one of the very main pathways through which social and environmental inequalities translate into health equity. So housing is a key determinant of health. And I think maybe before question, I would like just to emphasize what we understand by housing. Housing is certainly the built infrastructure. So it's, the house, the place, people, the dwelling people live in. But it's also the immediate environment that is outside the house. No housing can be seen separately from its adjacent environment. But housing is not only the physical structure, it's also the immediate community. It's also the people living within the house. It's the members of the house. And therefore, we need to take this into consideration when we talk about housing. Mark, quick question. Do we have the slides?
I can see them. Does everybody else can see them? Right now, we are in the site of housing design health.
I still have the opening slides. Okay.
I think we can all see them.
Okay. Fantastic. Strange. Okay, I still have the opening introduction slide on my screen, so
okay.
Apologies. Okay, so housing and health are very, very strongly interconnected in the sense that there are, and you see this on the slide with this quite complex diagram that actually has been developed by Philippa Howden-Chapman and colleagues who are presented with Lucy here from the University of Wellington. Actually, housing has a key impact through a number of different pathways. So first of all, the social demographic factors will have an impact, as well as the economic factors that will actually have an impact of what people can actually afford. So what type of housing, what quality of housing actually population-wide people can benefit from. And depending obviously on the type and the quality of housing, there will be a number of housing features, of housing elements that will have a direct and indirect impact on our health. It's about the issue about insulation and weatherization. It's about whether there is sufficient water and sanitation. It's about the adequacy of the space. So how much space are we facing overcrowding or not? It's about density and quality of the structure and durability. So all these elements have a key impact on specific health assets. So for example, lack of physical activity or harmful substances, contaminated water that ultimately would result in poor health outcomes. So there is very, very strong evidence about the interlinkages between the housing quality and the health outcomes, both in terms of physical and mental health and well-being. And you see on the slide a number of, examples. But as I was saying before, actually, housing is a much, much wider complex. So if we can move to the next slide. So it's the slide with the number of different publications. WHO has been addressing the social and environmental aspects of housing to make healthy and safe housing for all available. And you can see here that we have been doing this from a multitude of different perspectives. Actually, going back almost 15, 20 years ago, in the discussions about the Social Determinants of Health Commission, a sectoral briefing was produced about really showing how housing had to be addressed as a key social determinant of health. But then moving from there has been the recognition that housing also had to be put in the broader climate change and the resilience discussion. So, for example, the way that housing is built, housing as part of, if I could say, the green economy, the way that we are building houses will have an impact actually on climate change and climate change mitigation in particular. But by definition, and in the way that these climate change measures will be translated into housing policies, will then translate into health and health equity benefit. And then just to give you one quick example, there has been the clear recognition about the importance of the way that we are designing and managing our house for new emerging actually diseases, in particular vector control and sustainable development overall. So all this has then resulted in the development of, Mark presented it earlier, in the WHO Housing and Health Guidelines that were produced in 2018, and it actually brought together the strong evidence about the health impacts of housing features and by providing key recommendations for action. So if we can move then to the next slide, the aspect of housing and health equity has now been, even in the latest discussions, be brought up again on the health agenda. Very recently, earlier this year, the World Report on Social Determinants of Health Equity were launched. And if you have a look at the key aspects that were addressed within that report, you will see that housing features very strongly as one of the key sectors to be addressed and to be invested in order to reduce health inequities. And one of their key recommendations, and this is just one example, is that we need to equip local governments to reduce health inequities, and that we need to make sure that healthy housing and built environments, including through universal design principles, are being put on the agenda. And even more recently, actually just a couple of days ago, just 2 days ago, WHO has been working on providing guidance on policy and strategic actions for mental health. And again, urban and rural development sectors have been identified as one of the key pathways to achieve better mental health outcomes. And one of the key recommendations is to be creating safe, affordable, and accessing housing. And you can see on this slide some concrete examples of what can be done. And last but not least, from a very statistics perspective, if you look at the European Health Equity Status Report, you can actually see that housing deprivation really is featuring as one of the key factors that is impacting the health impacts overall. I'm just trying, can you see my slides now? I realized that maybe, okay, perfect. So moving forward, because we want to bring housing and health in the broader agenda, maybe just to focus also on the importance of housing, health, and resilience. And you can see here one example of some of the key challenges and local responses that are related to buildings in terms of resilience and why they are important as regards to their environmental, but most importantly, health benefit. And here you will see that there has been a key recognition that there are a multiple of challenges that we are facing, like heat, flooding, pandemics, that will have actually a key need in finding local urban planning and management responses in order to avoid and mitigate the environmental and health risks. And if done in the right way, will show great benefits in terms of heat mitigation and adaptation, resulting in a decreased health impact on respiratory and cardiovascular diseases, for example. And then moving forward, as we are discussing the importance of housing, in particular for youth and adolescent population, housing risks for health are particularly important for vulnerable populations, the elderly, obviously, but most importantly also for children and the youth. Children and adolescents are more exposed to many risks within the housing environment, and you can see here some examples. Not only indoor, but also in the immediate housing environment. And this is just a bit of a sneak preview of a work that we are jointly developing with UN Habitat and UNICEF on providing guidance on public spaces for children. And you can see here that the way that we are shaping our public spaces in the immediate housing environment will have a key impact on adolescent health outcomes and well-being. So in conclusion, if I would like to say, there is a clear recognition that housing is central to achieving the Sustainable Development Goals. Very recently at the World Social Summit, there was a strong recognition and also commitment by ministers from the European region, but also beyond, to commit to address housing emergency situation and to investing in more houses and more sustainable housing. And even more recently, during the COP, there has been strong discussions about providing sustainable and affordable and climate resilient housing for all as one key development agenda to be pursued, I would say, by multiple partners. So in conclusion, there is no doubt that multi-sectorial solutions are required for addressing social and environmental causes for poor housing. And this is particularly important for the most vulnerable populations that we will be discussing today. And housing-related interventions need to be complemented by policy interventions related to education, employment, health system, and taxation in order to be really truly integrated and comprehensive. So this is just to kick us off in the discussions. And Mark, back to you.
Thanks, Natalie. Thank you for your intervention. It's been really insightful to have this sneak peek on what the topic and the interconnections of housing with health that we're going to be speaking about, and also to expand a bit more, including economics, and then also recognizing the relevance of housing that has been increasing in the recent years since the pandemic. And also now that has been highlighted during COP and the social summit. We're gonna go now to our next speaker, Lucy. She's joining us from New Zealand, from the University of Otago. She's a senior researcher fellow, and she's been working with the implementation of the WHO's housing and health guidelines, and she is leading the Collaborating Center on Housing and Wellbeing. Lucy, the floor is yours. Thanks for joining.
Atamarie kia koutou. Good morning from New Zealand and welcome. I'm just going to see if I can see my slides as I present. I'll just scroll forward. Here we go. Okay, so this morning I'm going to be looking specifically at the physical aspects of the home. I understand other speakers are looking at other parts of the broader picture of housing and health. And in this next 10 minutes, I will be starting with the question of why we focus on youth specifically, and then moving into the question of how better housing protects youth health specifically. I want to talk about housing interventions and the fact that they work, and then move on to policies and standards and regulation that can address housing and health. as well as the WHO Housing and Health Guidelines and what they talk about and what they contribute to this picture. And finally, I'm going to touch on where to start to improve housing quality for youth. So the first question is, why do we focus on youth specifically in the housing quality context? So the point that I would make here is that youth are a particularly vulnerable population. They are more exposed to unhealthy housing conditions because they spend more of their time at home than other age groups. But also we know that for their health, that a healthy home is a health intervention. When you have good design and a warm home and ventilation and safety for children, that will save their lives. And in terms of the kind of the life years gained, if you're addressing the health needs of children, then you're really extending the overall health of the population. Now, the next slide, we're talking about, we know that better housing protects youth health. So we have multiple studies in different settings looking at different exposures and different outcomes. Natalie has touched on that a little. There is an enormous amount of evidence for the benefits of better housing for youth health. We've had individual intervention studies. In New Zealand, we've looked at insulation, and we've shown that when you insulate the ceiling and underfloor of homes in temperate countries, then you do increase the temperature in those homes and you do reduce the hospitalizations of those children and the numbers of days off school and visits to health practitioners. We've also shown that when you replace poor quality heating with better heating, that you similarly have better health, more time at school. And those are individual studies, but there are also multiple intervention studies. Across a broad range of housing exposures. So whether you look at the housing materials, the maintenance of those homes, the amenities that are available in terms of electricity and water, the sanitation facilities, addressing the damp and the mold and the humidity, improving the ventilation, reducing indoor pollutants, improving thermal comfort, addressing the amount of space that people have, so reducing crowding, and at the same time addressing privacy or reducing injury hazards, then you will get a range of health outcomes, and some of those may be surprising, and having more than one intervention often results in multiple better health outcomes. So we see improved psychological well-being, improved learning and development, improved sleep quality, reduced respiratory disease, gastrointestinal diseases, child mortality, so survival and growth and development, the reduction of vector-borne and parasitic diseases. And in a review that I'm partway through now, we have I'm only about halfway through, and we have a huge number of studies on housing conditions and quality. And even within those papers, it's very clear that a broad range of housing quality exposures have adverse impacts on a broad range of child and youth health outcomes in a broad range of settings. So not only in the high-income countries, but low-income countries, and vice versa. These studies are about health impacts when there are problems with housing. But what we want to focus on today, I think, is how standards and policies can improve health. So it's one thing to show that yes, when there's a health exposure, that the health is poor, but it's the next step to show that when you improve the house, that the health improves alongside. And I know that there are a range of programs in this space worldwide. I may talk more about those that I know best in the New Zealand context. The key thing is that we know that those housing interventions work too. So I've talked about the insulation study and the heating study. However, although those single intervention studies are excellent for producing evidence for at a quality level that we tend to use in reviews and so on, actually the multiple interventions where a program addresses more than one thing at once also work and work well, even if you can't say exactly which intervention is doing more of the work than others. And they do have other advantages. The hardest part in any intervention is getting to the point where you're actually walking through the front door of someone's home, or hopefully there is a door, so doing as much as you can while you are there makes sense, because you may not be able to come back again soon. So in the US, we have seen that in-home education and reduction of in-home allergens reduces children's asthma symptoms. In the Healthy Homes Initiative here in New Zealand, there is a broad range of interventions. So we improve insulation and heating, but also the bedding, we address damp and mold, we address the housing envelope and make sure that there aren't leaks and so on. And that those interventions, we've had a 5-year evaluation. We can see that child hospitalizations and mortality, even in health costs, have all been reduced by those interventions. We've also had studies that have looked at injury hazards and reducing injury hazards in the home. And again, we see that there is a very strong benefit in reducing injuries when you go in and fix the things that are clearly injury hazards. So whether an intervention addresses a single health issue or a multifaceted set of issues, then it will improve health overall. The other thing I'd mention is even in the malaria space, if you're going into a home, that if you're addressing a range of factors, so you're not just improving the seal of the home to prevent the ingress of insects, but you're also providing bedding, mosquito nets and so on, then again, that's a multiple intervention. Now, the next side is about policies and standards and regulation, and what we can do to address the issues. I mentioned information and education campaigns, pardon me, as the first thing here, because they tend to be perceived as easy interventions, and it's something you think, well, you know, we can improve people's education information so they know what to do to make their home healthy. The difficulty with these is it is very hard to change people's behaviour, and for youth in particular, children and youth, they tend to not be the decision makers in their home living environment. So although you can educate parents and so on, you still leave the youth at the vulnerable to whatever their parents are able to do based on that information, and often people know what they need to do, and the information doesn't necessarily change the fact that they can't do it. So there are other interventions that are important in this space. So we can fund, from a public policy point of view, where we see winter energy payments, that they do improve the warmth in the home, and that in turn reduces child health or health. We can fund public housing, and that is a much bigger intervention, which will possibly come up in other speakers. We can set standards for rental properties, and we are seeing a rise in those standards being implemented around the world. And again, that's at a policy level, addressing the underlying rules and regulations that mean that children are more likely to be living in a healthy home. In the same space, we can improve building codes so that when new homes are being built, they are to a better standard. And similarly, we can fund retrofit programs for existing homes. I haven't mentioned that in this, but they should have been there. And then finally, I would mention the necessity for addressing future threats. So it's climate change and carbon, which I think the third speaker is going to talk about as well. And there are, of course, when you have regulations and so on, there are, of course, challenges with enforcement and with getting policies right. So you can have a law against crowding, but it doesn't necessarily help people find suitable housing. That's not necessarily a physical thing. So I will include in this list the WHO Housing and Health Guidelines, and these were developed in 2018. We have 5 or 6, depending on how you count them, guidelines. We have a crowding guideline saying that we need to do things to address crowding. We have 2 guidelines on indoor cold, one on cold and one on insulation, saying in temperate climates we need to insulate homes, and we also need to try to improve the indoor temperatures. We also have a guideline on indoor heat. At the time, the evidence for that was not as well developed as it is now, but we recognise that it was a problem, and that in populations with high temperatures, we need strategies to protect populations from indoor heat. Home safety and injuries feature, and also accessibility. And I think of these guidelines as additional guidelines. They are meant to sit alongside existing guidelines on basic health needs like amenities for water and sanitation and hygiene, and environmental contaminants like lead and asbestos and air quality, and standards for carbon dioxide and radon and so on. So they don't stand alone in the broad set of WHO guidelines for housing health. So the next slide, I want to talk about where to start. So there's a great piece of work by Nix et al. Looking at which housing policies actually worked, and their review found that policy development and implementation are improved through awareness of housing and health. So that's the information campaigns I talked about earlier. The evidence, improving the evidence of existing housing conditions and health impacts, having collaborations across sectors and between residents and decision makers, and effective enforcement systems so that there are a range of things, incentives, tools such as certificates for compliance and housing inspections that help people get there. In a broader sense, I'd say where to start is a tricky question, because you do have to start where you are. I know that this is an international seminar, and we all know that the starting points vary hugely. And we're talking here about improving housing to improve youth health, but youth live with their families. Their health they're affected by their families' well-being. What's good for children and youth is good for everyone. And I am a bit wary of we were asked to talk about what were the most practical, most significant practical steps people take. And I think that potentially everyone wants a silver bullet on housing, but with a limited budget, there's not really a kind of a one, two, three. It's more of a whole set of different things that work together. And that's true both in the home itself and at an intervention and policy level. What I would recommend as a place to start is that every city find and fund a youth housing champion, someone who's really committed, maybe even a bit obsessive, and willing to advocate over a long time frame to achieve change. And that is the end of what I have to say. That was my final suggestion there, and I look forward to hearing from the other speakers. Oh, pass on. I apologize for the voice. Very early in the morning here. Yeah.
Thank you, Lucy, for your presentation. It's been really insightful to get to know how materials, indoor temperature, crowding can shape and affect health of the youth. However, if we're zooming out, if this house is located in an unsafe neighborhood with a lack of basic services or resources, maybe what we're winning from one side, it's going to be contrasted negatively from an other aspect. Um, we will be moving on to our next speaker, to Tarcyla Fidalgo. She is a lawyer with a PhD in urban and regional planning. She is specialized in land tenure and community development, and she is working in catalytic communities as coordinator of the Favela Community Land Trust. The floor is yours, Tarcyla. Thank you.
Well, hello, good morning, good afternoon, good evening, everyone. Well, as Mark have just said, I'm from Brazil, so I will share probably a different perspective about the relation of land and housing rights and youth, a perspective more from the global south, considering the conditions, the specific conditions of informal settlements there. So please, you can as the slide, please. Oh, I think I can do it here. Okay. So, well, here in Brazil, accordingly to our newest data, we have 4 million youths living by now in informal settlements. So it's almost half of the population of Portugal, for example. It's a large number of young men, young girls, most of them Black and most of them poor. So we have all these conditions intertwined in this youth that lives in informal settlements here. So we don't have any specific data about health issues related to these specific populations, youth people that live in informal settlements, but much is said in the news, in articles about a large number of mental issues in this population, as well as health issues, of course, related to the lack of infrastructure, as said for my colleague before me. But I want to talk about a specific point that is really important to be highlighted, and of course, it could only be highlighted by someone from the global south. You can see in these pictures a portrait of the violence that hit the young people that lives in informal settlements. We have here some pictures of police acting in the territory. We have a picture of young people dead on the street, and we have pictures of children on the floor because they are in the middle of the fire and they need to go to the ground during a class or during some cultural activity to survive to this point. So these territories, the informal settlements in Brazil, are called favelas and not slums. And you will see at the end of my presentation why. But favelas are a very stigmatized place. People used to say that in favelas we just have criminals, we just have people that should be arrested or dead, or that should be outside the city. So we live in a lack of recognition of these territories as part of the city. Just for you to understand the proportion of this kind of territory, I live in Rio de Janeiro, and here where I live is the second largest city in Brazil, and the favelas, the informal settlements, represents 27% of the territory of the city. So we are talking about a lot of land We are talking about a lot of population, a lot of youth living in this territory and suffering by this stigma. So we have these territories, the favelas, occupied by criminal organizations. In these territories, we don't see any action by the state, so we don't see any action to improve the infrastructure, to give it to the houses better conditions, to give it to the territory the adequate urbanization, to give it to the youth conditions to go further in their plans, in their formation. So, as I said before, in the favelas, we have mostly young, Black, and poor people. And this is the type of the population, the youth too. And these people are stereotyped as criminals. So this is why this kind of picture that I have shared with you is possible, because the population supports the genocide of the youth, of the Black youth in these informal settlements, because for them, these young men specifically, they are criminals and must be, well, must be dead. But also, favelas are these kinds of territories in this picture. Favelas are very creative territories where we have a strong solidarity bond, and it could represent a very good place for the youth to live and to grow up. So what is the turning point between the first group of pictures and the second one? The turning point is the recognition of these territories, the recognitions of the land rights, the recognition of the housing, and the policies coming from the state to improve these territories. But of course, we will only see improvement if these territories could be recognized as part of the city. So this is why land rights and housing rights are so important for the youth in the global south, specifically in Latin America, where this reality that I have just showed to you is reproduced in almost all the countries. So it's fundamental to guarantee that the youth, specifically the Black youth that lives in the favelas, in these informal settlements, will be potentialized and not dead or stigmatized for living there. And as I said, the turning points are the land and housing rights. So what we see for the future in this context, it is really important to guarantee that we will develop models that could guarantee the land and browsing rights in a perspective of the permanence of the community. It's common here. We have some policies to improve some territory, and then we have a process of gentrification, and the Black youth and the Black population is just put away from this territory, more valorized since the infrastructure policies, and we should guarantee that they can stay. And this is where the Favela Community Land Trust came. We are working with the Community Land Trust model that is a very well-known model, internationally recognized, that works to guarantee land rights for the community and individual rights about houses, about constructions. And with this, we take away the land of the market and guarantee the permanence of the most vulnerable people in their territories. At the same time that we guarantee the development of these territories accordingly to the needs of this population. So the Community Land Trust is a very well-known tool in the global north. We have a bunch of examples in the US, Belgium, in the UK, France, and now we are trying to spread the word about the Global South, trying to guarantee the land and housing rights in this perspective to guarantee the recognition of the favelas of these territories for them fight for the development, fight for infrastructure, and of course guarantee not just the improvement of conditions of living for the youth, but also the living of this youth that is by now being dead with the support of the population because they are all stigmatized as criminals. And here at CatCon, the organization where I belong, we also have another project related to young people in favelas. There is the Sustainable Favela Network. There is a network that aims to support projects and activities that are already in course in the favelas, in these territories. And most of them are led by young people. So young people are producing projects to guarantee the sustainability in these territories. So we have solar energy systems. We have a bunch of new ideas, new projects coming from this youth that must be supported to help these territories. So that's what I want to share with you today. It's actually more a provocation for us to discuss not just the improvements that should be part of the policies of housing for young people, but also the violence and the stigmatization that is so common in the Global South and should be addressed. Thank you very much.
Thank you, Tarcyla, for this great presentation, and thank you for framing this issue specifically from Brazil with the favelas and how land is linked to violence. It's linked to stigmatization in Brazil because neglecting 25% of Rio's population is a huge problem from different governance level. And we don't have to forget that this violence, exposure, and stigmatization is also linked to different mental issues as anxiety that the youth can have through going through these experiences in such young ages, and how this anxiety and violence exposure can impact on their education and other aspects from different social determinants of health. Moving from this social aspect on housing, we're moving to the next topic and next speaker, to Milka Kori. Milka Kori is going to be speaking about the link between climate resilience and housing. And Milka is a program officer in City and Settlement Planning and Slums Dweller International, Kenya. The floor is yours. Thanks.
Thank you, Mark, and to all the speakers. So I'll be presenting on the climate resilient and inclusive housing, giving case examples of what we are doing at Slum Dwellers International. And just to give a brief background of SDI, so SDI is a global movement, slum dweller movement across different regions, different countries in the Global South. So the main focus is we look at organizing the urban poor communities and seeing how we're going to amplify their communities, the voices within the communities, and how the communities are going to transform their living spaces. So we work with various federations, we call them federation or informal slum dwellers movement. We call them the federations. So these are youth, women who lead these engagements within the communities and try to at least advocate for better services, better housing within their settlement. So at SDI, for housing, we look at housing as a foundation for safety, health, dignity. You'll find that people living within the informal settlements mostly don't look at these proper housing mechanisms. They'll just put sheets or cartons for them to actually call it as a home. But at SDI, you see like housing is the foundation for health, safety, and dignity. So we see that without proper housing, and when the informal settlements are impacted by the effects of climate change, it exacerbates their living situations, and this makes them more vulnerable to climate challenges, the climate crisis that we normally face. Whether it's flooding, they're the most who are mostly impacted. Whether it's issues of urban heat, you will find them mostly facing the urban heat. The heat situation within the informal settlements is actually high. So at SDI, we look at how we are going to support or co-lead with the communities to generate evidence, can actually be part of this process of improving their houses, whether incrementally or whether the communities want to do a whole housing intervention. So we look at how we can support or co-work with the communities to actually bring improvements or rather intervention solutions to these housing challenges. So you'll find so inclusive housing, just as my previous speakers were saying, it's more than a physical structure. It relates to the environment, the neighbors. It's not about the four walls that we normally talk about. It's more than flooring. It's also about the neighbors who we live next to, the environment, whether within the communities. So inclusive housing, it looks at the diversity of the realities of these communities. You'll find the communities have different perspectives, what they'd want to call as a whole. You'll find they'd want to have community spaces. They'd want to have, say, top-notch types of housing. So we look at that as well. So inclusive housing prioritizes groups. It doesn't only focus on the high income earners. It focuses on the groups of women, the youth, the PWD, the tenants, the migrants. You'll find that when, say, governments are doing housing interventions or slum upgrading, they'd want to develop houses that are way past their earnings, their living wages. You'll find that most of these communities, they'd prefer not to move to these houses because the rent that they're going to pay is going to be high and won't be able to support themselves, their living conditions. So inclusive housing looks at how the women, the youth are going to be part of this housing per se. So it ensures that these groups are part of these communities that plan, shape, and design the houses that they're going to live. You'll find that, I'll give the examples of Kenya. The government per se would sort of start developing houses without having like community and get a feel of what they'd want, these home improvements of what the communities would prefer to call as an upgrade of their houses. So they'd come with these new innovations, new interventions of how the housing upgrades are going to look like. But this will leave out the marginalized groups, people living in the informal settlements. It will leave out these groups that are the key people who are actually the target groups of these improved houses. So inclusive housing will generally look at the safety, accessibility, mobility, affordability, the privacy concerns, and the security of tenure. You'll find that most people in the informal settlements don't want to actually invest in housing. They say the next minute the government can actually come and sweep away their settlements. So most of them don't look at this. They don't want to invest in housing, but this also brings in a lot of health issues to them. They find they don't want to construct good houses, but you'll find them mostly being impacted by health issues. Say when flooding comes, they're the ones who are being affected by this diarrhea, typhoid, malaria, and they don't have enough services within the settlements. So you'll find them being a little bit hesitant to do this housing. So inclusive housing, say, it will look at how the communities live, would want to see, say, the communities also want to be part, or they'd want to preserve their cultures. There's a way of living these communities have. So inclusive housing will look at how can we preserve these cultural aspects of these communities while also improving their houses. So you'll find this is a case example of how the communities actually construct their houses. It's just like the roofing materials, putting tiles on top of their roof so that it's not blown away. You'll find that it's not properly fixed to the house because there's that fear, or rather they don't have enough money. They put soil sacks on the walls so as to prevent water to come in, but still the water still comes in. You'll find the floor, most of the houses are usually earthen floors. They don't want to put concrete to these houses, but you'll find this will actually cause health issues to them. You'll find when it rains, the water doesn't seep through. It goes and forms like sort of mud, and people in the informal settlements will still live in this situation. So we go to the climate resilient housing. What do we mean? For the climate, the resilient housing, it's not about just a shelter. It's looking at how to build the resilience of these communities, looking at the materials that they are using. Is it safe for them? You'll find that most of these roofing tiles, the mabatis, the iron sheets, they're mostly like second-hand. They're from industries, but most of the communities don't look at how these materials are affecting them. You'll find if it's a second-hand, it has like issues of chemicals. It's not the proper roofing tiles roofing sheets that are required. So it's looking at these materials and how to actually build like a resilience in the. So looking at also when impacted by fires, floods, how can these communities be adaptable? How can they adapt to this situation while making the houses being more resilient? So we also look at the environment, the drainages. How can the surrounding support themselves? How can the surrounding be better be able to adapt and recover easily to these climate shocks? So construction, it goes beyond the construction, looking at the drainages, the drainage systems, the mobility, the transport within the settlement, the energy they also use. You'll find most people in the informal settlements using charcoal, and they don't want to cook outside. So these cooking energies they use inside, and you'll find the smoke that is being emitted within the house is actually affecting their health. So you'll find that people in these informal settlements, they don't want to put windows or proper ventilations within the houses. And you'll find that this smoke, this, as we know, it affects the health of these people living within the settlements. Looking at the climate resilient housing, it's looking at what is within the communities. You'll find that communities have this knowledge of what they can use, what is available within these communities. And you'll find that most of these communities don't have the funding, or rather they don't have enough resources to actually get these materials for them to construct these houses. So looking at also how can we utilize whatever is within the community so that we can actually preserve the cultures, look at the local knowledge that the communities are actually having, so that they can actually construct like good climate resilient housing that are actually going to better their health. We'll go on to the case studies. We've done a couple of case studies and trying to actually implement some of the some of these housing interventions together with the youth, the women within the communities. So we are running a campaign, or rather a project called Roof Over Our Head campaign. So this is actually like a community-driven approach. You'll find the Roof Over Our Head campaign is actually the communities actually leading these conversations. They get the communities together. They start on discussing on, they actually understand that the housing that they have is not proper. And for those who don't have this knowledge, they share the knowledge across the communities. They say this and these materials are not good for them. So within these conversations that they're having, you'll find actually the youth taking charge of these conversations. They try to bring up to speed the women, the men, the elderly on what are the new, they have the knowledge of these new materials, or rather what they can use to actually proper themselves in terms of housing. So we do like participatory risk mapping to identify these most vulnerable houses within the settlements. You'll find there are those within a settlement, within a cluster, within the village. There are those houses that are poorly constructed, and people living in that house are actually having like a lot of issues. You'll find them having asthma issues, the chest issues, but then they don't have any mechanism, funding, resources to actually improve. So the youth, the women actually gather and say, these are the most vulnerable communities that we want to actually support them in improving their houses. So we have like sort of workshop, we call them labs. So we sit down with the communities, the youth, the local artisans, the skilled laborers, the unskilled laborers within the communities. And you'll find the majority of them are actually the youth. So we sit down with these community members, try to look at if you want to improve your house, how would you want your house to look like? What are some of these kind of interventions? Would you want to improve? So most of them will say roofing. Most of them will say, I want to actually to lift the foundation, because most of these houses, they don't actually consider the normal construction regulations. They just construct houses for them just to live in. So they say, most of them will say they want to improve the foundation, the walling, because it's not proper. So we try to sit down, look at these areas of priorities, and try to actually look at how can we improve, or so some of these solutions that are some of the solutions that they'd want. And we'll also have, with this project, we are collaborating with the universities. They actually give us their expertise, because they're in the market, they know what's within the market, and they can actually consult, or rather give advice.
Sorry, Milka, if we can wrap up and go to the key takeaways. Thank you. We're a bit delayed on time. Thanks.
Okay. So we look at also some of the saving mechanisms, because also it's a matter of issues. There are already funding, or rather solutions that the communities are using. Say if they'd want to have housing interventions, how can we also support them? You say their lack of resources. So how can we support these communities to actually improve their houses within their means? So they do group loanings and say, we want to actually support each other. So it's more of community-led actions. Things that we actually, or rather the key takeaways, we see that incremental upgrading, I don't know if the slides are moving, but the key, okay. So the key takeaways of this, or rather the campaign, the project, we look at incremental upgrading as a solution for people within these informal settlements. You'll find they'd want to start small on improving their houses. So community involvement is actually key for them to actually say, this is what we want, this is actually affordable, this can be replicated to other settlements and will be durable within the communities that they live in. We know that technical support plus local knowledge will actually be better for these communities, will fit the context of these communities, and without even like extra knowledge what the communities are proposing, or rather the government. So also financing remains the biggest barrier, but we'll find that community models work. The group loanings, they have the cooperatives within these communities. They can actually use these models to finance themselves, not as to for them to look for this banking. They don't wait for banks to support them, so they can actually use these models. This is what we are trying to help them understand that they can use these models to better their houses and also their health. Housing improvement is a visible impact of health, safety, and well-being. If we improve the house, it's going to improve the well-being, the safety, the privacy, and people say, if flooding comes to a settlement, no one will have the stress of how am I going to move my things. So what we need is actually to scale these community-led designs and training for local builders, so for this thing to be replicated. Settlements, different settlements, the same settlements. So also integrating housing design, housing into climate adaptation, as the first presenter, Natalie, said, can be actually be beneficial to these people living in informal settlements, and also to improve their urban, the health. So advocating for policy support to formalize and scale such models is also key. Yes,
Sorry,
I think
Milka, we need to
yeah, I
move
think
on
that's
to.
it. Yeah, thank you.
Thanks for your presentation, and also to highlight how inclusive housing is linked and community involvement is required for improving the resilience of housing and the settlements. We're moving to our last but not least speaker, Robert, who is a senior advisor in land, housing, and human rights here at UN Habitat. The floor is yours. Thank you.
Thank you. Excellent. That was going to be my question, whether you have the slides. Can you hear me okay?
Yes, we can hear you.
Splendid. Well, thank you very much for giving me the opportunity to speak today. It's always a great pleasure, and you've given me a fairly tough act to follow with the sort of depth and quality of the speakers that have gone before. Happily, I probably won't match their depth, in that as a lawyer, I'm going to look at things in a somewhat mechanical way, but I'm very focused always on what these things mean in terms of how they fit within government systems and how they fit within concepts of rights. And I think one of the things that I want to highlight starting off is this first slide. There is no debate. Adequate housing is a human right. We're not talking about whether it should be considered as such and what the details of that might look like. This was established a long time ago. This started in the legal sense with a lot of the work that was pushed by Franklin and Eleanor Roosevelt in the 40s, with the idea of the freedom of want. And right from the start, in the freedom of want, they had the concept that housing was fundamental to that. You cannot consider freedom from want without considering adequate housing. And they also very early on were pushing the point that this is a universal concept. It's not something that belongs to certain parts of society or some countries or some regions of the world. It is a universal right that all human beings have. So that led up to the discussion of the UN Bill of Rights, the covenants, and the Universal Declaration. Now, I know that in some corners of the world, there are some states that will say, well, we didn't ratify the Covenant on Economic, Social, and Cultural Rights, so therefore we don't consider that housing is a human right. Well, unfortunately, most of the world disagrees and says that actually the right is considered to be a matter of customary international law and applies whether or not you ratified the convention. And even if you did ratify the convention, we then move on to some of the other issues. Looking at what that means, then we come on to the slide we have in front of us now, the question of state obligations. There are a couple of different dimensions to this. One is obviously the question of what is a minimum obligation of a state. And there is a fairly widespread point of view that states have an obligation, regardless of their resources, to ensure that nobody in their country is ruthless in some form or another. This doesn't only apply to homelessness, there is a qualitative aspect to this as well. And there is also another element of the question of basic due process, the idea that if somebody occupies a house, inverted commas, somewhere, they already accrue rights. So the discussion of saying, we're in an informal settlement or this is an illegal occupation or whatever, fine, there may be some legal questions around that, but the person occupying that space still has rights. And those rights are subject to due process and they cannot just be removed arbitrarily. So everybody should have some sense of rights. And as soon as we move beyond some of those minimums, you get into the world of progressive realization where, okay, we are talking more about not expecting governments to achieve everything on day one and having a progressive development of standards. But a substandard or an inadequate house is still a house and it still accrues rights, for example, around occupancy and tenure. But what happens when you move into progressive realization? Governments have an obligation to make budgetary prioritizations. If they are not making sensible budgetary provision for addressing the basic unmet need, then they are not meeting their human rights obligations. Similarly, policy prioritization. If a government is just saying, well, we're going to encourage mortgages and the provision of housing finance so people can do what they want, that's not good enough. We know that in most countries, at least 20-25%, and in a number of developing countries, anywhere up to 40, 50, 60%, cannot take advantage of those financial mechanisms. So you are not meeting your human rights obligations if that's as far as you're going. You have to go further. This is described in more detail in general comment number 3, but there's also quite a lot of jurisprudence on this where there have been disputes and governments have been found to be wanting. So even in the lowest income settings, there are some expectations, there are some standards, and there are some needs. And if we can go on. So just to come up with a point that several speakers have already made, and I really want to reinforce, housing and spatial regulation is public health. These are not separate areas that we have to integrate and think about. They are, and they have always been. This is not something that we're inventing and we're trying to push in the last 10, 20, 30, 40 years. The very origins of housing and spatial regulation is public health. You can go back to the Roman era and look at how they did urban design, how they looked at urban infrastructure and public investment, and it was driven by public health requirements. In the modern era, where this sort of came back in the late 19th century and the early 20th century, you look at the discourses and the interventions of people like Geddes and Elmer Wood, and they were very clearly based on public health. The contents page that is put up here is Elmer Wood's book, I think from 1940, looking for the US government on public health, on housing regulation. And 2/3 of it is public health related explicitly. How do health experts rate our housing? The cost of bad housing in preventable sickness and death. The cost of bad housing, don't like the language, but in juvenile delinquency and crime. Looking at the public health dimensions of housing was why we were looking at housing policy and regulation in the first place. So it's absolutely fundamental and indivisible and never should be considered otherwise. Moving on. The connection with youth outcomes, now leaving aside the delinquency and crime thing, which I think is probably just as applicable to adults as it is to youth. I think it's more a human nature tendency. We know, as has been very amply demonstrated by the previous speakers, housing is fundamental to both physical and mental health. We've always known that. We live it every day. And that obviously is also very connected into economic welfare, because as has been said by several speakers, your ability to pay for better housing has a fundamental impact on what happens and where things go. So obviously, if housing is fundamental to physical and mental health, and our young people live in houses, as everybody, almost everybody does, 98% or whatever, then obviously housing is fundamentally important to youth, as it is for all. But as has been highlighted, this point that there is a particular vulnerability and a particular challenge faced with youth, which is partly about their development. We know that if you face physical situations that create more, respiratory diseases, exposure to infection, all sorts of other things, we know that will have longer-term impacts into your adulthood. And that is a question that is particularly relevant for children and youth. Similarly, the social environment, the developmental impact upon your physical environment is a well-documented thing. And then moving more purely into the social side, the fact that housing and its position particularly is a key determinant of social and economic opportunity. So every dimension of how children and youth develop through their lives is at least influenced, and in some ways is fundamentally conditioned by their housing. I would also add, I know the discussion here is predominantly public health related, and I suppose this comment also relates to the idea of mental health in some ways. But the cultural adequacy of housing, that component is also critically important for many communities. If you aren't able to live in housing which reflects your cultural and social traditions and needs, that creates distortions. And sometimes those are modern needs, as we've seen in some situations. We have youth who are excluded from their families for different reasons. Sometimes that may be LGBTIQ youth, it may be economic factors, it may be criminal justice factors, but they get excluded from their homes. If we don't have adequate solutions and flexibility within our housing stock to deal with these kinds of situations, that creates another series of knock-on problems. So as we've known from the situation of homelessness, as we've known from the situation of very low income and itinerant communities, also with youth and children, we need to have adequate housing solutions for when things don't go according to plan and we have emergency needs. So all of this comes through and will shape somebody's future life and their perspective and their association with their community at large. So these things are all fundamental factors that we have to absolutely consider. I would like to also pick, before sort of closing out, I think there was a point made by Milka about the link with climate, and that's come up in a few places. I would highlight, yes, obviously I agree there is a fundamental relationship between climate change and housing in many ways, and in some regions that's affected more by others. But I would argue that in the large majority of cases, it isn't that climate change is creating a new problem. The problem was already there. What climate change and its impacts are doing is showing that we have systemic problems in our housing stock and our housing systems that are becoming exacerbated by the change in situation. The fact that the housing was not able to be placed in appropriate locations within a city, or that people didn't have access to adequate materials to build resilient housing, those are the underlying problems. If we had addressed those to begin with, we would have much less trouble dealing with climate change. So climate change is something that comes in afterwards. Also thinking about the question of incremental upgrading, I want to highlight that absolutely agree that incremental upgrading and built on a good site, a very good aided self-help strategy can be extremely effective. But it's extremely effective usually when the government has withdrawn from the sector and isn't capable of meeting its responsibilities. We must keep pushing back on saying there is a minimum public responsibility that is non-negotiable. And that needs to be considered, as Natalie said, within that multidimensional context. It needs to be looked at from a public health point of view as a starting point, but we also need to look at the social and economic dimensions of how we can realize that most effectively, because as I'm not a public health expert, but as I'm sure Mark and all public health experts will tell us, just treating the medical side of it is not going to solve the issue. You have to look at the socioeconomic dimension as well. And then finally, I'm thinking that they're also coming up in the comments from Brazil and a little bit also from Milka again, the question of the government attitude is fundamental. And I think that again comes back to this question of minimum and progressive realization responsibilities. If a government doesn't have a constructive, positive attitude to what you're trying to do, everything is going to be 10 times harder. And for sure, the government is not going to be meeting its human rights responsibilities and can and should be challenged on that at every opportunity. So the final slide that is up there now is just the plug to say, this is a very good discussion, but we need to have more of these, and we need to translate that and bring more people to the table and catalyze more action. And the World Urban Forum is a very great place for doing that, particularly given that housing is the theme this year. And while it's listed as cross-cutting, which always makes me a bit nervous, cross-cutting issues always feel like they're left over. I would say, as I have from the very start in this presentation, you cannot discuss housing sensibly without considering it as a public health intervention and a public health policy. So that should be central at the World Urban Forum, and I hope you will all be there to help us achieve that. Thank you.
Thank you, Robert. You've been summarizing everything beautifully. I have not much to add. Just I appreciate you brought some of the other aspects of adequate housing that have been left over as cultural adequacy, or the aspect of social exclusion, how it's linked to homelessness, and how housing is not facing a new problem through climate change, but it was already a systemic problem. We're very sorry to close the session here. Many of our speakers had impactful messages to share, and we had hope for a more interactive discussion, but we understand everyone has other commitments. And if you have any follow-up questions or comments, please feel free to reach out to us by email, share it here on the chat, and we'll address them via email. Please stay connected with us through our channels, especially the Urban Lab LinkedIn page. I hope this learning session has been meaningful, interesting, and insightful for all of you. Thank you all for your participation, and my sincere thanks to our exceptional speakers. Thanks for joining during this hour and a half. Until next time, thanks all for joining. Thanks to all the speakers. Thank you.
Thank you. Bye-bye.
Bye-bye. Bye all.